when you are funding your own care, there are a number of different resources that you can link into. And what I'd like to ask you about is what they are. If I maybe list a few for you, and if you could explain them for me, that would be really helpful.
Mhm.
So if we look firstly at attendance allowances, could you please explain what that is?
Yeah, so it's a really underclaimed state benefit actually. So it's not means tested, which is quite unusual for a state benefit. Not means tested, it's tax free, and it's paid directly to the individual who needs care. So the person who needs attending, that's where the name comes from. So there are two rates payable, a day rate and a night rate. I must impress upon people that the claim form is quite onerous, but there is usually help available to fill it in. So there are advocacy services, or we have, for example, some links to videos that can actually talk people through how to fill it in. But if anybody needs care of any level, then they can make a claim for attendance allowance, and as I say, get either the higher or the lower rate.
The other topic that I would like to ask you about is if you could explain what funded nursing care is, please.
Yeah, so with care, it's really sort of split into two systems. There's social care, personal care, help with washing and dressing, etc. Or there's nursing care, which we would be much more familiar with, that would take place in a hospital setting, for example. So if somebody's care is predominantly a nursing need rather than a personal or social care need, then actually there's the funded nursing care is a level of support that's available. It's paid directly to the care provider, but it takes the edge off that increased cost, if you like, for nursing care.
Thanks for that, Nicky. That leads us on to my final question, which is a really important one, and one that we find difficult to understand, and that is about CHC funding. So a lot of people aren't aware of what that is, and it would be great if you can explain that, please.
Yeah, again, it's a complex funding stream for sure. It's quite difficult to obtain, but it's, if you like, the level above that funded nursing care that we just spoke about. So if somebody's healthcare needs are relatively low, they just get that weekly contribution. But if their healthcare needs are quite high, and actually words like complex, unpredictable, unstable, that's a very high level of healthcare support, the National Health Service will actually pay for all of their care costs. So again, I would liken it to being in hospital. You would have all your care costs paid for there. Just because you're in a different setting, it doesn't mean that the NHS stop paying. They should actually, in certain cases, still pay for someone's care. There's actually a checklist, a tool that you can see on the NHS website, where you can look and see what they're scoring you for. So that gives you an idea what level of support you'd be needing before you were eligible. So as I say, it's very difficult to claim. We work with lots of legal professionals that can actually help make challenges, but first and foremost, it does need to be a nursing need. So if you're in a residential home with personal care needs, even if they're at quite a high level, this funding's highly unlikely to be available to you.